Today we're going to start a very important topic, which usually occurs to the patients when they are on the dental unit. So let's start it. Bismillahirrahmanirrahim. Okay. So basically, it is vasovagal syncope. Vasovagal syncope is basically fainting. The syncope is used mostly for fainting and vasovagal because the nerve which is involved in this process is vagus nerve, which supplies most of your body parts. So basically, the triggering or stimulus point for the vasovagal syncope is your this anxiety. Due to anxiety, what happens? Your sympathetic nervous system is activated, and due to which there is an increased release of catecholamines. So catecholamines are your adrenaline and non-adrenaline. So basically, what it does that basically it activates your or it attaches your beta one receptor of blood vessels, and when it activates the beta one receptors, adrenergic receptors. So basically, there is a dilation. When there is a dilation, though, so there is a decreased peripheral vascular resistance. Okay, and there's a pooling of blood in your periphery. What happens that most of the blood is now moved it into the periphery, due to which the arterial blood pressure is decreased now, and as it is basically, so it increase the heart rate. Okay, it increase the heart rate. We know that uh, during sympathetic, your heart rate increases, feeling of warmth because your all the blood is moved into the extremities. The patient is paler, means pale. Then perspiration and rapid breathing, which is caused by as a compensatory mechanism. Your compensatory mechanism is activated at that point. Now there is a decompensation. Basically, what happens now? Your reflex, which is vaguely mediated bradycardia. Now you have a bradycardia. Bradycardia is basically now decreased heart rate is basically you have a decreased heart rate here. Basically, what happens? Okay, you have nausea, you have hypotension basically, and there is also a reduced peripheral blood flow because the patient has all the blood is moved into the periphery. The patient has syncope or lightheadedness. So if this process is prolonged, then the patient has also a seizure activity occurs also start. Okay, so very important point that anxiety, the catecholamines are released. The catecholamines will do what? It will attach to the beta 1 receptors, beta 1 adrenergic receptors of the blood vessels, and there will be vasodilation. So there will be a decrease peripheral vascular resistance. The pooling of blood will occur on the periphery, and there will be a decreased arterial blood pressure. So the patient will have increased heart rate, then feeling of warmth, pale, rapid breathing, which is caused by compensatory mechanism. Then there will be a decompensation. That increased heart rate will move into the increased heart rate will have decreased heart rate. Then the patient will have a nausea, vomiting, hypotension, reduced blood flow will occur actually, which is already, and then the patient will faint. And if this is prolonged, then the patient will have seizures activity also. What to do in this patient? Number one, so if the patient has a prodrome is basically what that the patient has a signs before that the patient is not faint, but there are signs. Okay, so what you have to do, you have to stop all the dental treatment. Very important. Place the patient in a supine posture with the legs raised above the level of head. Why we do this? Why we raise the legs which is above the level of head? Because there is an increased blood flow to the head. Very important. Calm the patient actually and have a cool towel on his forehead because it is warm. Monitor the vital signs like blood pressure, respiratory rate, heart rate, etc. Then the syncope episode. If the syncope episode has occurred now, matlab that the patient is faint, so what you have to do, stop the treatment. Okay, and then again the position is very important. Always remember the position in all the medical emergencies are very important. So what you have to do, raise the legs above the head level. Place the patient in supine and raise the legs above the head level and check for breathing. If patient has a breathing basically, If the patient does not have any breathing absent, so start the basic life support, which is CPR. Okay. Acha, have someone summon medical assistance, mean calls for medical assist, and consider like signs. If the patient has like cause of syncope include like patient have hypoglycemia, cerebral vascular accident, and cardiac dysarrhythmia. If the breathing is still present, what you have to do, that you have to put crush ammonium ampuller under the nose, which is very important, or either also administer the oxygen. Monitor the white signs and have the patient escorted home. Plan and anxiety control measures during the future dental care. So basically that I have told you how to reduce the anxiety. Okay, now next we are moving towards the diabetes mellitus, very important point. Okay, so diabetes mellitus is basically, it is a metabolic disease. It is a metabolic disease in which the patient's long term prognosis appears to depending on keeping the serum glucose levels close to a level. We know that diabetes is mellitus is basically, there are two type of diabetes. One is type 1, the other is type 2. Okay, in type 1 what happened, that your uh, Langerhans does not produce the insulin, but in other it is due to the diet actually. Okay, so yeah, so one point that is that it is a metabolic disease basically, and it is like you have to normalize your glucose level. Okay, serum glucose concentration in patients diabetes represent a balancing of like it depends that how much insulin you have administered. Okay, then the primary causes of glucose you have like dietary gluconeogenesis, like adipose tissue, muscles, glycogen stores, means from this you can get the glucose. Then you have actually physical activity, like it means by some serum glucose is level, due to which. Okay, then serum glucose level can also fall because of the following, like having a large amount of insulin injected, or decreasing the dietary caloric intake. Okay, due to which your glucose level can be decreased. Increasing the metabolic use of glucose, like you are doing exercise or you have emotional stress a lot. Okay, how you will manage the patient of diabetes mellitus, very important point. Always remember, treat the pa- treat the patient of diabetes mellitus when you have a controlled diabetes. Always check the patient's diabetes. Prescribe tests to her, that do this test, and if the patient has a controlled diabetes, then start the treatment. Acha, having an early morning appointments and avoid lengthy appointments. Always remember, tell this patient either to come in the morning, do a breakfast, or either take on their day that insulin injection, and then do the treatment. And do not keep these patients on a very lengthy appointments. Okay, use an anxiety reduction protocol, which I have already told you. Monitor the vital signs like respiratory rate, blood pressure during, even after the surgery of the patient. Having a continuous verbal contact with the patient during surgery. Take care. Okay, now if the patient does not drink and eat before the surgery and will have difficulty after the surgery, so tell her to skip her oral hypoglycemic medication that day. Okay, it's very important. The diabetes mellitus patient management is very important. If the patient comes to and he suddenly faint, hypoglycemic, so it's very important that you tell the patient on that day either basically skip your hypoglycemic agents. Okay, if the patient has eaten before and after surgery, instruct him her not to eat a normal breakfast and take the usual dose of hypoglycemic agent. Okay, okay, if the patient want to eat, so tell her to or after the surgery, so tell her that take your the normal dose of hypoglycemic agent. Okay, then again watch for the signs of hypoglycemia. Treat the infection aggressively. Always remember that the infection spread chances is more aggressive or more in the diabetes mellitus patient, so you have to be very careful in these patients. Okay, okay. So basically, hypoglycemia is another medical emergency which can occur to the patient if the patient have not taken her breakfast. Okay, so and the other point is that the patient has basically limited amount of glucose in her body, and he or she is taking the usual dose of insulin, so it can also occur hypoglycemia. The next, it is very important, the patient who are taking hypoglycemic and have also problems with the hypoglycemia. Okay, because the serum glucose level can usually less pronounced than those in diabetes 1, so they can have less likely to quickly become more hypoglycemic. Okay, very important point. Again, when there are signs of, or you can say manifestations of acute hypoglycemia, there are three levels: mild, you have moderate, and then you have severe. In mild, what happens, there's a hunger, nausea, and mood changes and weakness. Okay, like patient have a hunger and nausea, mood changes. In moderate, there's anxiety, behavioral changes, we have aggressiveness, confusion, uncooperativeness, pallor, perspiration, and tachycardia. In severe, you have hypotension, seizures, and unconsciousness. Very important, like when a patient has an acute hypoglycemia attack, so what you have to do, you have to terminate all the dental treatments, and then you have actually three. So according to that level, you have to actually treat the patient. Number second, what you will do, that you will basically administer a glucose source either in the form of juice or sugar. Monitor the vital signs, and then you will consult the physician when you doesn't know the reason why the hypoglycemia has occurred. Okay, then in a moderate, what happens, again you will orally administer the glucose in the form of juice or sugar, and monitor the vital signs. And again, what if the symptoms does not cure, so what you will do, you will give them 50% glucose and 1 milligram of glucagon IV or IM, which is very important. Consult the physician before for further dental treatment. And then the most severe form is, again you will administer the 50 ml of 50% of glucose, 1 milligram of glucagon in the form of IV or IM, and have someone summon medical assistance. Okay, then monitor the vital signs, give the oxygen, administer the oxygen, and transport emergency care facility, which is very important. So this is we have end up with this.